Can ADHD really put you at risk for heart problems or even cancer? And why is personal care so much harder with ADHD? I'm Dr. Roberto Olivardia, a licensed psychologist, and today I'm going to be answering the internet's biggest questions on ADHD and physical health. Is there a link between ADHD and heart health? There are many ADHD-related risk factors that can predispose someone to heart problems, including sleep problems, obesity, cigarette smoking, unhealthy eating, lack of exercise, which can be very challenging for people with ADHD. On a larger scale, there have been recent studies that have shown that having ADHD was actually more impactful on life expectancy than cigarette smoking, diabetes, and obesity, namely because people with ADHD have multiple risk factors that exponentially increase their risk of mortality. A particular note is people who are treated versus untreated with ADHD actually share an elevated cardiovascular risk. This is why education and knowledge is power. We can take this data and talk to our doctors and making sure that we monitor our heart health and use this as motivation to do what we need to do to minimize that risk. Can ADHD affect cancer risk? So preliminary studies have found that yes, having ADHD can increase the likelihood of colorectal cancer, testicular cancer, and certain forms of lung cancer. Now, there are many ADHD-related risk factors for that, whether it's obesity, whether it's cigarette smoking, substance use, poor sleep, but also managing our health requires a lot of executive functioning, making sure you're getting your dental checkup twice a year, your annual physical exam, a mammogram. All of that preventative health care is something that's very challenging for folks with ADHD. Now, studies show that even when controlling for all those risk factors, that there's still something about having ADHD that can elevate risk, but we're not 100% sure why. So more research has to be done on that. In addition, for those people with ADHD who are struggling with cancer, to understand that successful treatment and management of their condition also requires a lot of executive functioning, making doctor's appointments, making sure you're taking your medication, getting that refill at the pharmacy in time. All of that can be very challenging. But with awareness, we can successfully get the treatment that we need and make sure that we're doing what we can to minimize all those risk factors. Why is personal care harder with ADHD? First, it's so important to understand this is something that affects many people with ADHD and that a lot of people with ADHD have a lot of shame around. The truth is that personal care requires a high level of executive functioning. Everything from brushing our teeth, to making appointments, to taking medication, to eating on time, to sleeping regularly. All of these life domains are impacted by executive functioning issues. And many folks with ADHD may struggle with it and unfortunately have a lot of shame and judgment about themselves that they struggle with these tasks. The good news is that once we understand the ADHD and the role that it plays, we can avail ourselves to strategies and ways of working through it, some of which can be fun, gamifying ways of getting tasks done, others that might require us to set up timers and planners or having some level of accountability for some of these tasks. Sharing this information with someone who could be helpful, such as a provider, a parent, a good friend that has good organizing skills, is really key. And trust me, we've heard it before. You're not the only one who's struggling with this. Once you can avail yourself to those resources and strategies, it can minimize this problem for you so that personal care doesn't have to be so challenging. And if you're interested in the bigger picture, we've also got a video that explores the connection between ADHD and mental health. So be sure to check that out. We'll link to it in the description below. Tips for improving physical health with ADHD. Absolutely, there are lots of tips. And I always say to my clients, as I feel for myself, let's lean into it and kind of have fun with it. So, with eating, how can we eat more mindfully? Being aware of maybe some of the foods that might not be so good for us. Checking in with ourselves after we eat something as to whether we feel more nourished or we feel depleted of energy. Sleep, really trying to work on getting to sleep at a more regular time, a more consistent schedule, trying to find ways to sleep more deeply. Sometimes for people with ADHD, it can be really hard to shut their brains off at night. So we need to kind of create an environment in our bedroom to make sleep feel more comfortable, whether that's cooling the room down, sleeping with a weighted blanket, having ocean wave sounds when we're trying to fall asleep. Also, there are a lot of significant scientific studies that have shown the neurocognitive benefits of exercise. And I'm not talking you have to go to the gym 7 days a week, 2 hours at a time. Studies show that even 3 times a week of 30 minutes of exercise can have prominent neurocognitive benefits. It actually stimulates something in the brain called brain-derived neurotrophic factor. It's a fancy word, but basically what it's saying is your brain can process things more fluidly and quickly, and that's from exercise. Exercise also can stimulate dopamine and endorphins, which are those feel-good hormones and neurotransmitters. In addition to all of that, surrounding ourselves with affirmative people, having a sense of humor, engaging in activities that really give us a sense of pleasure also is really important for our immune function and for health in general. Does ADHD make you clumsy? Yes, for some people with ADHD, they can be quite clumsy. That bull in the china shop personality, however, is neurobiologically based. Sometimes for folks with ADHD, they're focused more on the thing that's 40 feet away versus the thing that's right in front of them. Sometimes they just get distracted by their own thoughts and aren't thinking and bump into something. That can be really challenging in certain situations. And for some people with ADHD, they don't have a strong sense of proprioceptive awareness. What that word means is being aware of your body in the space that you're in. So when you're in a crowded room or a literal china shop, it's really important to know how you're moving and how that movement affects the things around you. The ADHD brain can have issues with motor coordination, which can lend itself to clumsiness, but it can also manifest in other things like poor handwriting or fine motor movements. It's all part of the same thing. Now, let's face it, most people who are clumsy, it could be a nothing burger, it might even be funny, but it is important to work on and keep in mind because it can be a slippery slope from clumsiness to more serious accidents. Does ADHD increase your risk of accidents? Now, being clumsy is one thing, but serious accidents are another. And yes, people with ADHD are at higher risk of many accidents. This is due to many different reasons. One is being attentive to danger cues and situations that are quite dangerous can be a little bit more challenging for people with ADHD. Two, people with ADHD are more impulsive and sometimes are in the thick of a situation before they're really mindful as to the danger and the lack of safety in that situation. The other thing that's important is that the biology of the ADHD brain lends itself to being attracted to anything that's stimulating. Now, everything that's pleasurable is stimulating, but not everything that's stimulating is pleasurable, and danger is very stimulating. So what does this look like in the real world? Studies show that folks with ADHD are less likely to use seatbelts, more likely to speed. So we see a higher risk of automobile accidents. We can also see it in comorbid disorders such as depression and anxiety, which also can impair judgment in individuals with ADHD that put them at higher risk for accidents. We know that people with ADHD have a higher risk of addiction to substances such as alcohol and cannabis, which can impair judgment to an already vulnerable executive brain, and we know that can lead to overdose. In addition, people with ADHD might not adequately prepare executively for certain tasks that then could place them in harm's way. For example, if you're going on a summer hike by yourself and you don't bring enough water and you forget your phone, you could be putting yourself in a pretty bad situation. Does this mean that having ADHD is a guaranteed car crash or a real serious accident? No, but it does mean that we have to be a little bit more attentive than our non-ADHD counterparts to make sure that we're keeping ourselves safe. Hey, thanks so much for watching. If you found this video helpful, we actually have a lot more content like this on our channel, so make sure to subscribe. By doing so, you can help to further Understood's mission, which is to make sure that the 70 million people with learning and thinking differences like ADHD and dyslexia can thrive.